Ladies and gentlemen,
This is the Dental Up Podcast, brought to you by Keating Dental Arts, a full-service, award-winning dental laboratory. Each week, you'll learn tips and techniques from real-world dentists, bringing you in-depth interviews, motivating stories, current events, and sports. Here's your host,
The Senior Technical Advisor for Keating Dental Arts, Brandon Fetters.
Hey everybody, Brandon here. Welcome to another episode of the Dental Up Podcast. Today, we're going to be featuring what you should be looking for in a laboratory before selecting them to be sending your cases. With me today, again, we have Mr. Barry McGinnis, one of our Senior Technical Advisors. Thanks for joining us, Barry.
Thanks for having me again, Brandon. Love to be here.
Yeah, it's great to have you. We're just going to go ahead and kind of wing this thing and kind of toss this around as far as something that doctors should be looking at when selecting their laboratories. Of course, probably first and foremost, up on top of everyone's mind is price. And it seems like a lot of times it's chasing that lower price, but in the end, that can mean not as good materials. What are your thoughts on that, Barry?
Yeah, I believe they should be more concerned with the quality of the products they're receiving and then maybe the price. But, to each his own.
Yeah, that's true, because it's one thing to find a good value because you get what you pay for.
Yeah.
In a lot of these situations where you're running into these very less expensive type restorations that are being provided for dentists, a lot of times those laboratories can be found that they're actually outsourcing overseas. Have you experienced that firsthand?
Yeah, of course. It's always a good idea to double check and find out where things are fabricated. You want to know for sure where they're manufactured.
Yeah, indeed. And one of the coolest things about that is the ability to find out if your lab is willing to let you come in and visit, or if you can schedule something to truly get a more in-depth tour, so that you can actually see their facilities, how they're fabricating, what their process is from start to finish with these certain products. Because even, say, for instance, I've received emails trying to get us to outsource our design work for our CAD crowns, full contour zirconias or zirconia frameworks to be outsourced. But no, we keep that all under the roof here at Keating Dental Arts and do everything in-house. But even just those small little things can really dictate the way that something's going to come out, because it ends up becoming more of a cookie cutter process, if you will, and less customized.
Yeah.
Sorry?
I think we have the advantage here because everything is fabricated here, in the USA, in California, in our building. It's all made here.
Yeah.
So I think that's a big plus for us.
Yeah, you put a good point there as far as advantage, because it's kind of like we have more of a controlling state in that idea as to what the final outcome is going to be.
Yeah.
Of course, variables always will introduce themselves from time to time, the unforeseen, but it certainly helps out quite a bit. And along those customizations is also to make sure that your laboratory can develop a preference list that's, for you yourself, your account, how your cases, how you like to see them, whether that's, you want to have them a few tapes out of occlusion and make sure they're not high. You always want to make sure and have your, broad tight contacts in the proximal, because you'd rather do some adjusting and polish it and deliver versus having to send things back, because that's no fun for all three parties involved, patient, doctor, and laboratory. What about doing preferences? You've run into many customized preferences with doctors, I imagine?
Yeah, definitely. Most doctors, they all like it different. Everybody likes something different. So it is good for us to know exactly which doctor likes, things manufactured a certain way. So it is very important for us to have preferences for each of our doctors. It definitely helps in the long run. It helps with the quality and the final product that they receive.
Yeah, it's very true. And it made me think, too, because not only necessarily the dentist and how you like to see restorations come back, but a lot of the time it's a demographic in which you're working with.
Yeah, definitely.
Because, down here.
It can be regional.
Yeah, exactly. Because sometimes I see doctors and, they don't want any occlusal stain on there. And it's like, I get it. And I'm like, it just looks so much more realistic when we have, stain down in the fissures and everything. But then again, it's like, oh, you're in this ritzy area where the patients are probably like, I don't want to see that.
And everything's very white. They want everything white and just washed out. So they don't want any color anywhere. Yeah.
Right. That's very true. Kind of that when the Hollywood smiles and the bleaching kind of happened where, everyone in the dental industry is going from across the room like, whoa, those look fake. But the patients are like, I love these.
Yeah.
So yeah, I found that to be very true throughout the years too, that dentists, technicians, assistants, hygienists, we want to see what looks like a vital tooth
A
in
natural,
there.
yeah, exactly. A natural lifelike tooth. Yeah.
But in the end, the consumer at the very end of everything is
Yeah.
the patient. A lot of times, nope, I want my bright white teeth to look like some, some actor that they saw on television or something along those lines. But
yeah, and we're here to give them what they want, so
absolutely,
we do it.
yeah. I mean, shoot, we've even had a few pretty interesting things of customized designs on crowds.
Yeah, different
Sports
colors.
sports teams colors.
Yeah.
Didn't we have like a Kelly green kind of one that we did last year?
Yeah, and we had a pink one, a bright pink one.
That's right.
Yeah, different designs. People a lot of times will want gems or different stones in them.
Very true, but bonding those in is almost like a matter of time till those things are going to be coming out. I would feel, but one of the more exciting on those customized things, one of the things that I thought was a really cool look in the end was a PFM that we did porcelain fused to yellow high noble, and they actually had done it as a full contour wax up, then cut it back to have a crucifix design on the insert. So then the porcelain was all laid around it. I mean, it just looked really cool at the end, but
I didn't see that one.
Kind of different, but I'm kind of getting off subject here, talking about fun little customized,
Well, it relates because it's doctors giving us those instructions, those customization instructions for things like that.
That's true indeed. And and it does go back toward that, a cookie cutter or a custom restoration.
Yep.
So, now on that too is with the pricing, a lot of times that's not only reflecting if it's all done in-house, but it's also the quality of what those products are. So definitely I would be encouraging all doctors out there to be, looking what's your metal content, what your zirconia is made of, what kind of porcelain are you applying to both PFMs and zirconias. EMAX we all know pretty well because of Ivoclar, no doubt, but want to make sure that you're having those top end things here at Keating Dental Arts. We use the Noritake EX3 for our PFMs and the CZR for our porcelain to zirconia restorations, top end porcelain. It's really nice. What are your thoughts on that, B?
I like that we're using high end porcelains, high end zirconias. We're using the best metal alloys that we can find. We're not trying to cut corners and skimp in any way. We're trying to use the best quality products that we can find to fabricate these crowns and bridges. So I like that. That's why I work here, and it's something I can stand behind.
Right.
Yep.
Yeah, it's hard to take anybody down a path when you don't believe in a product.
Yeah,
but when you know that it'll support you, then it's pretty easy to go ahead and confidently do it.
Yeah, it's easy to back up and support it.
No doubt. Now, on that, kind of along the same lines, is also finding out. I would encourage dentists to find out what type of implant systems that your laboratories work with, because despite the fact we work with all of them, we've had a few that are just completely obscure. We had to contact places in Europe to try and find parts, but it's always good to find a laboratory that can do as many things under their own roof as possible for the most part. Even when it comes to just as simple as doing your UCLA abutments, if you will, the cast 2 UCLAs. But also, now we're doing our Keating custom milled abutments, which is pretty awesome. And that tends to help, again, with that cost, the less that anything's going out. But
that is the benefit to being able to manufacture those things here is we can offer them at a lower price.
Exactly. Yeah. And so still, solid titanium.
But still, good quality. Yep.
And then a lot of times, doctors like to have their implants anodized, which certainly helps out a lot, especially when we're in the anterior region. So, beneath the gum line where that collar of the abutment is or anything along those lines, it's going to warm up the tissue, make it look more vital versus having that graying effect. Have you ever had any experience with doctors when they use obscure implant systems or systems that aren't even supported anymore? Any nightmare stories you care to share?
I have come across, I don't recall the name of the system, but I do remember a doctor trying to send one in and we had to call and say, we're not aware of this and we can't really work with this. That was a long time ago. I think that was in the beginning, but I don't remember the name of it.
Now, also in finding out these products, aside from implant systems, you want to know alloys, the porcelains. Also, really encourage dentists to be able to find laboratories that are full service, mainly because this makes it super easy. You don't have to, this going to that lab, this going to this lab. Next thing you know, you accidentally sent this case over there. Even though we all know dentists on average usually tend to have about 3 laboratories. You got your high-end guy, your guy for your wham bam thank you ma'am type work, and then somebody else that maybe you're trying out. But to make your whole office run smooth and have everything, it's just so easy when you just have that one laboratory to get it over to.
Yeah, definitely with combination cases as well. When doing fixed and removables together in one patient, definitely is an advantage to have it all in one building.
Yeah,
for sure.
Absolutely. Yeah. So definitely find out what kind of removable prosthesis they're able to fabricate, from the frameworks all the way to flexible partials, to see what's really out there and make sure you're getting the best bang for your buck. Also want to find out what their quality control process is, how your cases are going to be checked, and if you can even have certain other aspects checked in there as well. I know here I utilize that quite often myself when I'm working with a dentist on certain specifics, and I want to make sure and double check that case before it leaves. Tell us a little bit about that, Barry.
A lot of times, even as a technical advisor, we do act as quality control in the end. Some, with certain cases, certain accounts, we do like to see those before they leave the lab. Even though there is a quality control person having already seen that case, I do like to, double check that and see it myself sometimes. But it's definitely positive to have quality control in the laboratory. I know that I've worked in places in the past that didn't have quality control, and we definitely suffered because of that.
In the end, too, it's kind of that feedback thing. I know Dr. Gordon Christensen's talked about it for years, too, is we're all a team, as far as dentists and technicians, and working as the voice of the laboratory, and as well as the ears a lot of times in the trenches with the doctors, being able to get that feedback to help us become better. And then, like that previous episode where we had you on here, Barry, and we were talking about impressions and what to recognize, and a lot of times we can see things that can help doctors in the end have a much smoother process.
Mm-hmm.
And let's face it, in the end, if we can get something to where those seat times are 5 minutes or less, doctors, you're going to be a lot happier. Patients, I'm sure they're going to be smiling quite a bit more to get out there, move on with the day, and start living life. And,
less chair time, the better.
Yeah, because that can get expensive. So again, coming back around to that, having stuff that has to go back to laboratory, and in the end, that's the last thing that any of us ever want. Because if you have something like that, and if the confidence of the patient ever gets shaken, that's detrimental, and we can't have that happening. In the end, that's it's kind of a convenience of the laboratory. Here, there's those old commercials like get a flip top head where we get to open up the mouth completely and look into it. Obviously, patients can't do that. And the doctors in the end have to face that patient directly. So that can be very difficult. We always want to make that process as smooth and easy as can be.
Yeah. That's why we love the communication. We feel like it helps. It definitely helps in the end.
Yeah. And along those lines, I'd like to point out too that digital pictures for shades and how important that is. I mean, just how many times do you deal with that a day?
Oh yeah, we get many cases that have photos attached to them. Most of the time, they're going to be anterior cosmetic cases. We get cases, or we get photos sent digitally through the system or emailed to us, or we get physical photos. They definitely help with the final shading and all of the final contours and everything to match the adjacent teeth. It definitely helps us. One thing that we do come across is a lot of times doctors will say, we're sending photos, and then we don't get those photos from them. So that does create a kind of a traffic jam with their cases. But in the long run, photos are definitely a plus. If we can get photos for every cosmetic case, that would definitely help.
Yeah, certainly. And that kind of goes back to how busy, you're jumping from one operatory to another.
Yeah.
Things are going to happen.
Yeah,
that's
and
why we got to support each other.
If they're good quality photos, it's even better.
Yes. Oh, yeah. I mean,
with a good quality camera.
Yeah. We jumped back about 15 years ago or so when cell phones started getting cameras, and we started getting all these blurry pictures. We couldn't make out what in the world was going on. And now we got just amazing cameras on cell phones where they could capture things. But really getting those photos digitally, I'd have to say, is just absolutely wonderful. Nonetheless, are we then able to connect that to the case record and have that image, inevitably to always refer back to if needed in the future. But it's also one of those things that we run into with printed photos that all can alter greatly depending on the type of paper being used, as well as the ink levels in the printer. So highly encourage, Dennis, that you send digital photos for any cosmetic cases. Just made me kind of pop up and realize too, because just about everyone out there these days in the dental industry, we're all doing multiple types of zirconia. Say, for instance, we have our high strength zirconia, which tends to be more opaque and, of course, higher MPA on that. And then as we work in the translucency, we lose a little bit of strength, but still those guys are really strong. But in the end, every once in a while we run into something where you can't quite get those grayer type shades using the full strength. And a great fix that I've seen happen throughout time, you got this, these patients come in, like D2, D3, and A2, A3 are probably the most common 4 shades that we see out there from, the original 16 Vita. And those darker shades like that, especially if you're running into like a C4 or something, using those more translucent zirconias will enable to get that graying effect, to lower that value. Because when you have those high strength zirconias that are more opaque and you're trying to hide it all with stain, you can only get so much.
It's
sometimes.
all surface stain at that point. Yeah.
Yeah.
And it's going to wear off over time, and it's tough to get a good match that way.
Yeah. And even though, you're doing the pre-shading, you're saturating it, you're getting that through, or using a pre-shaded puck. Nonetheless, it's that light penetration that doesn't happen with the full strength, and it bounces right back at you and can kind of stick out. So if you're running into that situation to where you have a patient with those grayer, browner type shades, I'd really encourage you, really more so with the grayer, to try and use the more translucent zirconias in doing those restorations. It should be able to help fit in.
It should be a better shade match. Yeah.
Yeah, exactly.
Yeah, definitely. We do see that with the more aesthetic, the more translucent zirconia.
Yeah, that kind of makes me think of something too, even though, I'd mentioned the Vita Classic 16 shades now, and I'd also mentioned how we use Noritake here for our porcelains. Really, it's always make sure that you're indicating what type of shade guide that you're using. That's a very helpful thing for the laboratory. And, make sure that your laboratory also has those specific shade guides that you use there in their office, or maybe if they're using something different to match their porcelain, see if they can send them out. Here at Keating, we are able to provide the Noritake shade guides for dentists that are interested. And it just tends to help out a ton, because even though, the Noritake shade guide does still have the same alphanumeric of those 16 shades, they do differ in value slightly in comparison to the Vita Classic. So definitely something to inquire on your laboratory. What type of shade guides do you have? Of course, there's conversion charts out there if need be.
We can match any shade from any shade guide.
Yeah.
We just need to know which shade from which shade guide.
Yeah. So definitely any trouble with the shading. And along those lines too, make sure that you're replacing your shade guides every 3 to 5 years, because that'll happen too, to where shade guides throughout the process under these color correct lighting, they start to fade, throughout the cold processing. I've even, run into a couple times where they've been autoclaved, and those are little plastic tabs. They're not going to hold up. So, but yeah, it's plastic. So those guys in time will start to have a higher value to them as they start to wear. You ever had a situation where you were trying to match a shade only to find out it was an older shade guide?
Yeah.
Didn't match.
Either an older shade guide or a different shade guide, from a different company. Yeah. That happens quite often. So it's very important to know exactly which shade guide they're using before they send the case to us.
Yeah, and so it kind of makes me think about how basically everything we've been saying here is you want to be sure that you're on the same page as your laboratory. You're on the same wave.
Yes, communication is key.
You want to have that mesh, that good blend between dentist, technician, laboratory, and in the end, patient satisfaction. Yeah. So hopefully, do you have anything else you wanted to add on to that, Barry?
Preferences. Did we talk about that? Did we talk about preferences?
We did talk about preferences a little bit.
We did.
But go ahead and expand if you had something to add on to that.
I recall now we did talk about it. what other type of support do we provide besides like communication, phone, email support?
You know, the cementation processes.
Yeah, we do advise a lot of the chairside stuff that they do.
Yeah, and actually, even while we're talking about shades and taking shades, with those digital photos, make sure that you have the incisal of the shade tab incisal to the tooth that we're trying to match, so it's not casting a shadow on that tooth or on the shade tab because it's behind the tooth, and that it's also not bouncing back that flash. So you want to have them kind of on that same plane. Makes it a lot easier for us to make sure and nail that shade.
Yeah, and also when taking shades, it's good to have different lighting spectrums.
Yeah.
Have a little white, cool light, from your fluorescent lights in your office, but then also get by the window and get some of that natural sunlight coming in. That definitely helps.
Yeah. Full spectrum lighting is very important.
Yeah.
And another one to put out there too, when I mentioned about the higher values that happen, one thing that I've experienced quite a bit in my time is that shades will get taken toward the end rather than the beginning. Make sure and take your shades while the teeth are hydrated, because after they've had their mouths open for X amount of time, the teeth start to dehydrate and they'll raise in value.
Yep.
So I know people who've listened to multiple shows are probably like, Brandon's talking about that again. But it helps everyone in the end. So
it's a good tip.
Yeah. It's just want everything to go smooth for everybody. But really appreciate you being on the show with us, Barry.
Of course, anytime.
Yes, it's great to have you. Thank you, everybody, for listening in, and we hope to catch you soon on another episode.
Thanks for joining us on the Dental Up Podcast Show this week. Make sure to follow us on Facebook, Instagram, and Twitter, or search the Dental Up Podcast on iTunes for our weekly feed. Don't forget to visit KeatingDentalArts.com/promo for exclusive offers. Keating Dental Arts is a full-service dental laboratory, and we're nationwide. We'd love for you to send us a case so we can show you the Keating difference. If you dig what you heard, please leave a review on iTunes, and we'll be back next week.